So it was in about 2007, 2008 that I first discovered LDN, and we started using it immediately as a cancer treatment because there was some promising data presented by Dr. Bihari. So when we started using LDN for patients with stage 3 or stage 4 cancer with low disease volume, in other words, small tumors or patients who had had surgery already but were not completely cured, we started seeing better results. One of our earliest patients that we used LDN on was a 65-year-old gentleman with bladder cancer. He had a tumor in the bladder which was treated by conventional means, which means surgery. So they would go in and remove the tumor. They would burn where they had removed it from with a cautery, and inevitably the tumor would return some months later. So this gentleman had a few surgeries, and the doctors had told him it was an aggressive type of cancer, which is called high grade, and that because of the depth of the growth of the cancer into the bladder wall, it was growing into the muscle, they felt that he was at risk of the cancer spreading in a short time. So this fellow was offered aggressive surgery, which meant removal of the entire bladder, and he declined that. At that point, he came to us, and we started him on LDN, and he did very well on it. He had a little bit of sleep problem, but that was easy. We just gave him a little sleeping pill with that, and he did very well. And at the same time, his conventional doctor gave him a single course of an immune therapy called BCG. It's a bacteria that they instill into the bladder, and it can trigger an immune response. So while he had the one course of BCG, he was on LDN, and he took LDN for about 4 months, and then he had gone back to see the surgeon. They took a look in the bladder. The cancer was completely gone. So this gentleman continued LDN for about a year. He had no further conventional therapies, and the cancer remained in full remission. And it's been about 7 years now, and this gentleman is still in full remission. So in his case, he did extremely well, and I believe that the LDN and the immunotherapy worked in unison, and one synergized with the other in order to give him an excellent result, which in this case would be considered a cure. Another one of our earlier cases that really intrigued me was a 58-year-old gentleman that came to see us for a rare cancer that was present in the base of his tongue. He had about a 3-centimeter tumor in the tongue, which was an adenoid cystic carcinoma. That's just the type of cancer, but it's an unusual type of cancer of the mouth. So this gentleman went to see his specialist, and he was told that in order to cure his cancer, the entire tongue would have to be removed surgically. And because of the location, in order to really give him the best chance of cure, they would have to remove his voice box as well. And then there was discussion about possible chemotherapy and radiation after all that surgery. So naturally, this gentleman was upset because of the dramatic change in his quality of life that would follow after cancer treatment. So he declined conventional therapy. He came to see us requesting a therapy that had no side effects. So the first thing I told him was that there's no such thing that has no side effects. However, immediately I thought of LDN because it's one of the gentlest therapies I know. So he ultimately started LDN, and he combined it with vitamin D because that's considered to be a medicine that can potentially enhance other cancer therapies. It can work on the immune system and improve anti-cancer immunity. Vitamin D can also change the behavior of cancer cells into a more harmless behavior so that they don't grow and aggressively spread. So this fellow started taking the treatment with LDN combined with vitamin D, and within a few months he felt that the tumor was shrinking, and so he continued therapy. We didn't hear from him for a while until about 2 years after he started treatment, and he sent us a new MRI report, which is a scan of the tongue that showed complete disappearance of the cancer. So he continued on LDN and vitamin D, and he is now over 5 years cancer-free. His specialist is quite surprised and pleased to the point that he no longer repeats his scans frequently, and he just sees him once a year for a regular checkup. A couple of years ago, a 53-year-old gentleman came to see me requesting treatment for a bowel cancer. It's present in the sigmoid colon, and it was believed the cancer formed as a result of his inflammatory bowel disease called colitis. So this fellow was offered surgery by his specialist. That would have been the standard treatment and potentially curative. However, he was afraid of surgery. He was afraid of the complications. So as a result of his concerns, we offered him a few treatments, and he ultimately chose LDN. So he started LDN, and we were monitoring him with a blood test for colon cancer called CEA. And in addition, we also monitored him with colonoscopy. So his specialist would have a look within the colon and see what was happening with the tumor. It took about 4 months to see some improvement. We actually started to see the CEA, the cancer blood test number, fall. And it was falling progressively over a period of about 3 to 4 months subsequent to that. And then it was maintained at a steady value, about 30% below the original value. In addition, he did have a follow-up colonoscopy, which confirmed that the cancer was stable or smaller, and his symptoms of bleeding in the bowels actually improved as well. Now, this fellow did decline traditional surgery, which was not exactly what I had recommended either, because I thought that the cancer could potentially be curable. However, the case does demonstrate that in cases where, let's say, a patient refuses surgery, or if surgery were to be too risky, then LDN could be an option for a patient to try, especially if the cancer is non-aggressive. In addition to using LDN, we almost always recommend vitamin D. The dosing of vitamin D is very controversial, but there's adequate research now that supports using high doses of vitamin D. So that's what we're doing. We're using typically in the range of 5,000 to 10,000 units per day of vitamin D3, preferably in liquid form because it's easier to take, and so patient compliance is high. Sometimes we even need upwards of 15,000 units or 20,000 units of vitamin D per day. As an aside, I personally take 15,000 units of vitamin D myself, and I've been taking that for about a year now. I take it for my allergies, and I find it to be highly effective.
So I became acquainted with naloxone and naltrexone, the drugs, in my training over 20 years ago in emergency medicine. And early in my career in general medicine, began to explore the use of low-dose naltrexone for a variety of illnesses, including autoimmunity, pediatric disease, and then cancer. As the years of practice went on, we developed more and more cancer patient care where we were using the low-dose naltrexone as an integral part of the patient's therapy. We began adding low-dose naltrexone with a variety of cancers, not knowing for sure which ones would be more or less responsive. And back at that time, the data was very sparse, so we were basically asking patients if they were okay with us trying it. Many would come in with articles they had read, and we would start the therapy with them. We have had a number of responses that run the gamut from stabilizing disease to being very supportive of other therapies that were being done, both natural and standard chemotherapy and radiation in some cases. And then one of the most beneficial uses we have seen is in the patient who has come back from the oncologist and there is the report, there's no more we can do for you. So we use it in our program for stabilizing those patients where standard of care has run out. I think the persistence of our using the low-dose naltrexone as a therapy is owed to the fact that we see positive results frequently enough that we keep using it. With many therapies that are non-standard, you'll find that they work in a very narrow margin or for only certain types of cancer or certain types of illnesses. And so we'll reserve those for those certain type things. Low-dose naltrexone at this point, as I say, 8 or more years, has impressed me enough that I keep it in the beginning treatment when I'm working with patients almost across the board with cancer. So the results are quite varied. We have had some patients, especially elderly patients, where they're very sensitive to medications. they've been told by their oncologist that they are not a candidate for standard therapy because they're too elderly or frail. We have had a few of those patients where their disease, their cancer, has stabilized with basically the addition of low-dose naltrexone on its own. We don't expect that in everybody, but it's been curious to me to see one agent do that in cancer, which is very unusual. Most people, what we see is it is a very good synergist with the rest of care, and sometimes what will happen is a patient will stop taking it and not tell us. They'll come back and they'll have some regression or some addition of symptoms from their cancer. We'll find out they've gone off, they'll go back on, and often those symptoms will go back away. So we do see it as an integral part of care. I would say the number of patients with cancer that we have prescribed low-dose naltrexone for in the last 7 or 8 years amongst myself and my colleagues at my clinic would probably reach a number between 250 and 350 patients. As I said, we've seen a wide spectrum of response, all the way from it was the only thing that they could tolerate due to age or frailty, and we saw a stabilization of their disease, meaning it didn't progress, which is a very positive finding, to the person on multiple therapies where it's being used as part of a team approach. And as I mentioned, it being withdrawn caused a reversal of the positive. So I would say in at least 30% of people, we have some verification either based on it being the only drug used or it being taken away from their therapy and them having regression that we could really point to a clinical success. The rest of the patients, it's not that it made or broke their therapy, but we definitely left it in their therapy and never withdrew it to see if that was part of the success or not. But we definitely have seen, and as I say, with either on standard oncology or natural therapies, I've seen it be useful and positive in cancer cases more than most other therapies I've used. I would say that of all of the integrative and standard therapies that I have seen, both in chronic illness, but especially in cancer in the last 20 years, low-dose naltrexone has been one of the top treatments that has impressed me as far as outcomes, improving quality of life, and stabilizing disease. For patients, it's largely letting them know that it has a very low incidence of side effects and downside, and the most we can do is share case reports with them that match their cancer, and normally we have some positive ones. Of course, you can't guarantee anything in cancer, but to me, it's low downside, low cost, and a high value therapy.